Welcome to Diagnostic Imaging. I'm Senior Editor Whitney Palmer, and we are back this week with the latest radiology news. Researchers from the University of Nottingham have designed a prototype of a lightweight helmet that can be used as a brain scanner. This 49-channel device, described in the journal Neuroimage, can scan the entire brain, even while the patient moves, making it perfect for children or patients who have difficulty remaining still during imaging procedures. The device has the potential, investigators said, to shed light on a variety of neurological conditions from autism to Alzheimer's. After months of low image volumes, more than 75% of the hospitals and imaging centers that provide mammography services are seeing patients again. According to the data analysis from breast imaging analytics company Volpara Solutions, mammography volumes are on the rise. Throughout the pandemic, volumes declined nationally by up to 70%. But the analysis, based on 20 million anonymized mammography images, revealed that most sites have rebounded to within 10% of pre-pandemic levels, and approximately 5% have climbed above previous volumes. Reopening your practice after months of restricted activity can present challenges, particularly as your image workload is likely to balloon quickly. It can be easy to get stressed. To help you avoid potential burnout, Dr. David Fessel, professor of radiology at Michigan Medicine, offered 4 micro practices to sidestep this problem. He pointed to mindfulness moments, naming your emotion, gratitude practice, and diaphragmatic breathing as effective stress release methods. And in that vein, it will be critical in the next phase of the pandemic for you to give some attention to self-care and well-being. As volume levels rise and the pressures for social distancing and maximum disinfection continue, taking care of yourself will ensure that you can continue to provide the best patient care possible. This week, Diagnostic Imaging spoke with Dr. Rebecca Seidel, Associate Professor of Breast Imaging at Emory University, about the importance of self-care and available resources. Dr. Seidel is also chair of Emory's Wellness Committee and a member of the American College of Radiology's Wellbeing Work Group. Here's what she had to say.
To be here. Thanks for asking me to talk about this topic. It's something I think is so important.
Absolutely. Well, given that the concentration on self-care and well-being isn't necessarily a new topic in radiology, COVID-19 has obviously introduced a new component and a new dimension. So what are the factors that have been introduced by the pandemic that make it so important to talk about this topic right now?
Yeah, so well-being has been an important topic, especially in healthcare and especially in radiology, and a topic dear to my heart. And certainly, COVID has posed additional challenges for radiologists who are trying to maintain their health and well-being. Sometimes when we think about wellness, we think about it in terms of several dimensions, and we can think about each dimension and what challenges COVID has brought to those dimensions of wellness. For example, there's financial wellness. So COVID has introduced a new financial stress. Maybe people are concerned about their jobs, concerned about loss of income, uncertainty. And we think about the social dimension of wellness, and certainly that's been challenging, particularly challenging in this time, both personally for people not being able to see their friends and family, but also not being perhaps working together with their colleagues in the same place. Maybe they're working from home now and feeling more isolated. We think about the spiritual dimension of well-being, and people not being able to go to their places of worship, to be together with their community. Hopefully there's been other ways for people to maintain that, but there are many challenges in terms of spiritual well-being. Of course, physical well-being, we've gone through times where people have lost their gym access, their access to parks, places where they exercise and get fresh air and sunshine. So that's another challenge of COVID. Emotional well-being, the stress of uncertainty, of rapid change, and also perhaps stress of not having childcare, or having to worrying about family, or bringing home an infection to your family, or taking care of older people. There's so much emotional stress that played into this situation. And then vocational stress, having to find other ways to work, and maybe working from home when your kids are home is a new challenge that radiologists may have faced during the pandemic. So I think it's challenged our well-being from in every dimension.
Absolutely. And those challenges no doubt have had a wide variety of impacts or outcomes. What are some of the things that we have seen within the radiology community that have happened with radiologists, things that they have experienced as they have been facing these challenges over the last few months?
I think similar to other professions, we probably have seen increased stress, emotional challenges. Radiology can be sometimes a more isolated field of medicine, and now people having to work from home or maybe work more separate from colleagues, not gathering for at least for conferences or grand rounds or meetings in person. People can feel more isolated and lonely, and we're definitely seeing more depression and maybe especially early on more anxiety. And there's the COVID-19 of physical wellness, or people are gaining weight while they were quarantined at home, not able to go to the gym or do their normal routine. So, yeah.
Okay. Well, then, when it comes to dealing with these challenges and the outcomes that have kind of come from these new factors that people were thrown into, um, what are some strategies that radiologists can consider implementing to kind of help them work through it all, or at least make the experience a little easier?
Right. So I think it starts with just the basics of self-care that we should always practice, which is good nutrition, eat well, sleep, rest, adequate rest, and good sleep hygiene, getting adequate sleep, and exercise. I think these three things are sort of the base, the foundation of keeping yourself well. And beyond that, I think for many people have found some calming routines, maybe new routines that help them deal with some of the stress or worry that was associated with COVID. So I think for some people that's meditation, some people that's yoga, or just going for a walk, going outside and doing a mindful walk. But I think some people have had, if you're having so much difficulty or so much stress or so much anxiety that it's impacting your ability to take care of yourself, I hope that people are reaching out and taking advantage of any resources that they have available to get some extra help.
All right. Well, turning and thinking about work specifically, are there certain things that radiologists should remember as they re-enter the work environment that can potentially help them, maintain that sense of well-being and self-care while they're re-entering, a place where there's going to be a concern about, possible infection or making sure that, you're being as safe as possible?
Right. So one thing is radiologists, obviously we want to follow our hospital's protocols, whatever they are, if it's daily self-screening for temperature and symptoms, or being screened by a colleague or supervisor when you come into work. And then if people who share workstations, it is a good idea when you come in the morning to wipe down your workstation just for prevention of contact contamination. Some people might need to rethink how they lay out their reading rooms. If their reading rooms are very crowded and they're working very close to each other, people might have to think about how can they reorganize the layout or rework the layout so that the desks aren't as close to each other, or maybe use dividers that they hadn't used before. Maybe go to a shift system so there's less people in the reading room. So those are, just some sort of reading room things to keep people healthy. And then also just practicing good self-care at work. Of course, good hand hygiene, wearing your mask in all public places. And if you're in a shared space, like a shared reading room, keeping a mask on, which can be challenging, but protective. Also, I always recommend people try to alternate positions during the day, because as radiologists, we do sit a lot and we're at risk for, this has nothing to do with COVID, but just in general, I think we're at risk for repetitive stress injuries. So it's good to try to alternate between sitting and standing during the course of the day. And even if you can get some fresh air, go for a walk outside, or at least a walk around the hall, get some exercise during the day, take breaks, drink a lot of water, stay hydrated. And so most of these things are things that we do normally, right, to take care of ourselves and be well. And then just with the added caution of making sure we're always practicing the good hand hygiene, wearing the mask, and maybe doing extra wipe downs of frequently touched surfaces.
Okay. Well, I know that mindfulness has been a buzzword in radiology when it comes to avoiding burnout and practicing self-care. In that regard, are there small little things that providers might be able to integrate into their day that will, again, bolster that sense of well-being as they go through a long workday?
Sure. Yeah. So for people who haven't done any mindfulness or meditation, or if it's unfamiliar to them, there are many apps that have become available for free to healthcare workers. So those are some things people might want to take a look at, just to get an idea of what meditation is and what it is to be mindful. For example, 10% Happier is one of them. I'm not trying to plug, I don't have a relationship with any of these companies. I'm just giving examples of ones that I think are available right now at no cost. Headspace is another one. But I sometimes even, I think it's a good idea before you walk in to see a patient, or if you're not patient facing but doing a case, if things have been getting very busy, people asking you a lot of questions, the phone is ringing, it's a good idea just to take a few deep breaths to clear your head before you start the case, so that you know that you are, or before you walk into the room to see the patient, so that you know you're 100% present, not distracted, and focused on that person or that particular case. So I think that's something that people can do during the day. Just take a pause to take a few deep breaths and make sure you're completely present.
All right. Now, radiologists do tend to work a little solo from time to time, concentrating at workstations. But are there things that providers can do to help each other, to kind of build on that collegiality and that camaraderie within the work environment, to, again, bolster that overall feeling of well-being within a department or a practice?
Sure. Yeah, we sometimes are somewhat isolated, and this situation does not help that by any means. But I know in my department, people, or certain divisions, are hosting Zoom social events like Zoom happy hour, just to keep up with their colleagues. And of course, it's important that we all take care of each other and are sensitive if people are having difficulty, if they're having difficulty at home, that we should be reaching out and checking on each other and checking in. Are you okay? Is there any way that I can help you? Just being a good team player is more important now than it has ever been. So I think those are a couple of ways that we can keep the camaraderie going. Also, virtual journal clubs. Try to continue some of the things that we do together, even if we can't be all in the same room together when we do it.
Gotcha. Well, then, looking at this specifically through the lens of COVID, then again, why is it so critical at this point and going forward that providers make sure they focus on self-care and well-being? You know, what kind of additional problems or challenges could it present as we go through into this next phase if people, stop paying attention to their own needs?
Right. Well, in order to give the best care to our patients and be the best physicians that we can be, we do need to take care of ourselves. If we don't, we can get fatigued, we can get distracted. When your stress levels are very high, your cortisol goes up and you might have difficulty sleeping. If you're very anxious, you might have difficulty sleeping. You can take these things home and it can cause disruptions among your family or loved ones and make your relationships difficult. And unfortunately, while we are kind of ramping up and going into this next phase, I think that the issue of COVID is probably going to be with us for significant amount of time longer. So it's like a marathon. We need to be in it for the long haul, and take really good care of ourselves so we can all get through this together and come out well and stronger in the end. And so, like always, it's important that we establish routines and we make time to take care of ourselves. So sleep, like I said, exercise. I love to go to the gym. I haven't been going, but there are many videos you can do at home. Of course, you can exercise outside, and many gyms are offering fitness classes on Zoom now. So if you don't want to be in a gym, you can still have that interactive experience, that live experience in your house. So I think it's just very important that we maintain these health routines, that we take care of each other and the people we love, that we're forgiving and understanding when people are going through challenging times and maybe are not their best self, and that we ask for help if we need it, and when we need it, and that when we see people who are struggling, we encourage them to get help that they need.
All right. Well, overall, when it comes to the concept of self-care and well-being in radiology, are there any other points or factors that we didn't touch on that are important to kind of raise awareness and make sure that providers kind of keep forefront of mind?
Um, well, one thing is that I'm in academic medicine, so I work for at a big university. But I think it's important that everybody knows that there are many resources to get help if you need it. I mean, mental health care, or if you know somebody that needs it, and it's good if you're familiar, if your institution does have resources available to you, it's important that you know what those are, and where to get help if you need it. And I encourage people to reach out if they're struggling, and not get let themselves dive too deep into the depth of a struggle before they reach out and get the help they need. And I hope that many institutions like ours we have compiled in the past 2 months a tremendous bank of resources to help everyone get through this difficult time. And I know other institutions have done that as well. So I encourage people to take advantage of the resources available to them to be able to get through this time and come out stronger at the end.
Well, building upon that, and I know that you are part of the ACR's well-being committee. What are some resources that you would necessarily point to? And I know that you said each institution probably has their own, but are there some from just a higher level leadership perspective that we can alert people to?
Sure. So the ACR, I believe, has compiled a very nice list of well-being resources that are available on the website. So I think that's a great place to go take a look if you're looking for something. And I think there's really a lot out there right now. A lot of it is free, and I think people should try to be open-minded and try new things to find what works for them. For some people, some people find a lot of some people practice yoga regularly and find that very relaxing, and that's a very mind-body experience that can help ease anxiety, and also it's exercise. So I think it's good to just go through those list of resources and see what appeals to you and what might be helpful to you. But there's so much out there that is virtual and readily available right now. Fitness apps, fitness videos, yoga, meditation, and mental health resources. And it just depends on what you're looking for and what you need. But the ACR website is a good place to start.
All right. Well, Dr. Seidel, I appreciate you taking the time this afternoon. Thank you so much.
Thank you for talking about this topic. I think it's so important, and thank you for asking me to speak today.
My pleasure. Thank you.